Good afternoon. Thank you all for joining us today. I'm Amy Kelly. I'm the Deputy Director of the National Institute on Aging at the National Institutes of Health. And as a geriatrician, much of my career has been focused on improving the lives of older adults. And so I'm really excited to be hosting today's YouTube Live Q&A event that's focused on heart health and aging. And today I'm joined by Dr. Jerome Flegg and Dr. Lawrence Sperling. Dr. Flegg is a cardiologist and a medical officer in the National Heart, Lung, and Blood Institute, where he focuses on designing and implementing major studies to explore cardiovascular disease and health. Dr. Sperling joins us from the Centers for Disease Control and Prevention and is the executive director of the Million Hearts Initiative, as well as a practicing preventive cardiologist. His work is centered around a mission to help individuals embrace managing their heart health. And so I am so appreciative of you both for joining me today for this Q&A. And before we jump in, I just wanted to remind everyone with us that this is a Q&A, and we are going to do our best to answer a handful of questions at the end. Please do drop your questions into the comment section throughout the event. And before we get started, I just want to be clear that the information given or discussed today is not personal medical advice. We're sharing insights from the latest research as well as resources on this topic. If you need medical advice, please do speak with a healthcare professional. So it's a quick Q&A. Why don't we just dive in? So to kick us off, I think the first thing is to talk about why heart health is important, why we're even here discussing this topic today. Dr. Sperling, could you get us started on this?
Yeah, thanks. A perfect first question, Dr. Kelly. Heart health matters at every age. And most importantly, though, as we age, heart health matters even more. There are various heart risk factors, and those risk factors exert their risk over time. Hence, as we age, it becomes more and more important to focus on heart health, focus on these risk factors, because at every age, heart health matters. The Million Hearts Initiative focuses on building healthy communities, optimizing care, with a core focus on health equity. We'll get into this more during our discussion and conversation. Heart health is not unique to the heart. It's unique to the rest of our body as well. And heart health means brain health, and heart health means vascular health. So as we think about the key ingredients for promoting heart health and extending the health span, we can think about the benefits as well for the rest of our body.
Great points. And I'm glad you brought up how our heart changes with age. I wonder, Dr. Flegg, could you tell us more about that? For example, how do our arteries, valves, and the electrical system of the heart change over the years as we age?
Well, the blood. We think the primary initiating factor for our age changes in the heart are actually changes in the blood vessels. The arteries themselves that deliver the blood to the rest of the body become stiffer. They develop some calcium and less pliable with increasing age, and that's why hypertension is so common in older adults. We think that this then leads the heart to have to work a little harder, and then making the heart muscle become thicker, just like you were exercising against the resistance. And that thicker heart actually functions quite well, although it fills somewhat more slowly than its younger counterpart. Another change that occurs just because of the wear and tear and years of pumping, many years of pumping, is that the valves also show wear and tear, and they sometimes will calcify and thicken and calcify, which can sometimes lead to either narrowing or leaking of those valves, which may require, in some cases, a surgical intervention. In many patients, never actually reaches a point that requires medical intervention. And then finally, probably as a result of these changes that I just mentioned, rhythm disturbances become more common with increasing age, such as just premature beats And particularly one type of rhythm disturbance that increases with age and has a lot of clinical significance is atrial fibrillation, where the atria, the upper chambers of the heart, are not contracting like they should. And this can lead to an increased risk of stroke. And so there's a lot of attention nowadays to developing screening tools, even smart watches being able to detect atrial fibrillation in people who don't necessarily have any symptoms.
Thank you for that. And I'm glad that you touched on a few different varieties of heart disease. Heart disease can happen at any age, so it's important for our audience to all understand some of the risk factors involved, how to lower their risk, maybe the signs or symptoms of heart disease. Dr. Sperling, could you speak to some of those issues?
Yeah, certainly. So as we talk about heart disease, that's a very broad category, and those are disease processes that can affect various parts of the heart. The heart is a muscle. It's the center of our circulatory system, and many will say it's our most important muscle. Heart disease, though, can affect individuals at any age. As we've already discussed, though, heart disease becomes more common, and variants of heart disease become more common often as we age. The most common form of heart disease is blood vessel disease, vascular disease, and the problems that affect the arteries that supply blood to the heart and the brain. I will add that the majority of types of heart disease are preventable: heart attacks, strokes, and cardiovascular events. Dr. Flegg already mentioned high blood pressure, hypertension. This is the most common form of heart disease, especially very few American adults. High blood pressure, hypertension. We know that pressure is frequently not well controlled, but through lifestyle and behavioral approaches, as well as medications when needed, high blood pressure is a controllable condition.
I'm so glad you mentioned the risk factors and high blood pressure in particular. I mean, checking in with your doctor or healthcare provided annually is a great way to stay on top of blood pressure and other issues related to your heart health. I'm just going to pause there to remind folks who are with us today listening that you can submit your questions about heart health and aging into the comments section. We're going to try to get to a few of those towards the end of the Q&A. So, to stick with the question about modifying risk, healthy lifestyle choices are certainly a core component of bringing down one's risk and preventing heart disease. Medication is often part of this management of a person's risk for heart disease as well. And I know as a geriatrician, I certainly hear people who are reluctant to take medicine, to start it or even continue it. And I was wondering, Dr. Sperling, maybe you could tell us some of the common concerns or even myths that you might hear from patients in this area and how to think about those concerns.
Really important question, Dr. Kelly. I'd like to reframe it, though, as opposed to talking about the myths, because once we talk about myths, we often propagate those. So let's talk about some truths. At every age, but we're talking about the intersection between risk for heart disease and aging today, lifestyle and behavioral approaches are first and foremost. These are the foundation for the prevention of heart disease. A heart healthy diet, regular moderate physical activity, hopefully not smoking, but if you are smoking, focusing on tobacco cessation. For many, though, above and beyond the need for a focus on lifestyle and behavioral approaches, medications can be extremely beneficial in reducing the risk for heart attack, strokes, and cardiovascular events. As opposed to concern about side effects of medications, we should always consider the indications for a medication. What are the benefits of those medications? And thankfully, we have incredible medications today that can reduce the risks of high blood pressure, high cholesterol, and other heart risk factors like diabetes on the potential for developing heart disease. These medications have significant benefits above and beyond their primary effects, meaning lowering cholesterol, lowering blood pressure, lowering blood glucose, in that these medications can save lives and reduce the likelihood of a catastrophic event. It's about talking and partnering with your clinician, though, or your clinical team, understanding why a medication might need to be prescribed for you, understanding the benefits of these medicines, but also inquiring about the most common side effects. Side effects are not that common, but if you are experiencing side effects, don't just stop your medication because medications don't work if you don't take them. But bring this to the attention of your doctor, your clinician, or clinical team. And often it's finding the right medications for the right person, so don't just abandon. Really think about next steps and come back to that initial question we talked about. What's best for you and your heart health?
Thank you for that answer. I'm also curious, Dr. Flagg. We touched a little bit on some of the lifestyle choices. Would you be able to expand on that point for us? How people can reduce their risk for heart disease?
Yes, the American Heart Association actually has developed what they call Life's Essential Eight, which are eight risk factors, four of which are lifestyle, or actually five of which are lifestyle, and three of which are more actual, unrelated to lifestyle, such as hypertension and high cholesterol. And these eight factors can make a major effect on reducing, if they're adhered to, reducing one's risk for heart and vascular disease. And just to summarize them briefly, Dr. Sperling and I have already touched on some of these, but maintaining a healthy weight, eating a heart healthy diet, low saturated fats, low salt, exercising on a regular basis. And when we say exercise, it doesn't have to be anything heroic, but even just getting out and walking briskly. The Surgeon General recommends that we get 150 minutes of moderate to vigorous exercise a week, which is less than 30 minutes a day. And so it's achievable by most people. Then additional factors, not smoking, which is kind of like not doing something bad, but definitely cigarettes and any form of tobacco we know is a significant risk factor to accelerate heart disease, particularly arteriosclerosis, hardening of the arteries in the heart and elsewhere in the body. And then most recently, sleep has been added to the lifestyle factors, and it kind of got short shrift, I guess, in years past, but great attention in the last couple decades has been turned towards sleep, and many studies now showing that people who are who are repeatedly sleep deprived or have problems sleeping have much higher risk of cardiovascular disease. Sleep apnea is probably one of the most common evidences of this, when people really, wake up, frequently in the night because of obstruction of their upper airways. Then the other three risk factors are ones that I think are well known to most of our audience, probably hypertension, high blood pressure, high cholesterol, and particularly high LDL cholesterol, which is the bad cholesterol, and then blood sugar, particularly in patients who are pre-diabetic or diabetic, to control one's blood sugar. So these are all risk factors that can be, in most cases, in the majority of them, actually controlled by lifestyle, and the last three can be controlled by a combination of lifestyle and medicine. I should point out that actually a healthy lifestyle usually reduces blood pressure, reduces a cholesterol level, and may reduce blood sugar. So even though medications are frequently needed for those conditions, lifestyle can actually help control them as well.
Thank you, Dr. Flagg. You brought up some excellent points, and I wanted to take the opportunity also to draw the connection between so many aspects of what you mentioned, that highlights the connection between brain health and heart health. And a lot of people may not be aware that those things are so correlated with each other. At the National Institute on Aging, we really focus on a lot of research that deals with brain health and keeping one's brain healthy as you age. And the connections between brain health and heart health just get stronger each year. So as we know, the heart pumps blood through the vessels of your body, including your brain. And it's important to know that blood vessel damage or other risk factors that we've already talked about today can be serious, lead to serious health conditions for your brain as well. So thinking about strokes or dementia. And so when you are doing all of those things that Dr. Flegg just mentioned to keep your heart healthy, you're also keeping your brain healthy. Things like not smoking or quitting smoking, regular exercise, good sleep, decreasing stress. In particular, there's a strong connection between heart health and vascular dementia. Vascular dementia is the second most common form of dementia after Alzheimer's disease. And it's caused by conditions such as strokes that are related to disrupted blood flow in the brain. So it's important to note that not everyone who has a stroke will develop vascular dementia, but certainly a person's risk for dementia after a stroke depends on the size and number of strokes they've had and the underlying health of their blood vessels and, again, their heart and their arteries. So, thinking about high blood pressure, problems with the heart's rhythm, high cholesterol, all of these things that we've talked about in terms of risk for heart disease are also related to risks for vascular dementia. And so working to keep one's heart healthy is going to do double service to keeping one's brain healthy. So before we move to audience questions, I'd also like to touch on some of the resources that we wanted to be sure the public is aware of for folks who are out there looking for ways to improve their heart health. Dr. Sperling, turning to you, could you touch on some of the resources that the Million Hearts program has?
Yeah, thanks, Dr. Kelly. Million Hearts is an example of possibilism, that we have the knowledge, tools, and resources through proven and effective strategies to prevent 1 million or more heart attacks, strokes, and cardiovascular events across our nation. Many Americans are living with heart disease, and most Americans, especially as they get older, are living with risk for heart disease. Million Hearts, if you go to millionhearts.hhs.gov, you can learn more about the Million Hearts Initiative, which is co-led by the CDC and CMS. And Million Hearts, in partnership with the CDC Foundation, has launched several campaigns to focus on heart health. The one that is most applicable to this audience is Heart Healthy Steps. HeartHealthySteps.org is a campaign to raise awareness of heart risk, but also understanding that small steps for individuals can lead to significant cardiovascular risk reduction and improvement in heart health. So it's about understanding, it's about empowering, it's about learning, helping you and your family and your community become healthier.
That's great to hear. And I know there are also resources, Dr. Flegg, at the National Heart, Lung, and Blood Institute. Could you share some of those with us?
Oh, yeah, sure, Dr. Kelly. Several documents, fact sheets are available that are very educational to the general public. The first is the Heart Truth, which is basically a national health education program that raises awareness about heart disease. And that is very has a lot of detail and then could be very helpful. Other sources of information in the form of fact sheets. One is called Heart Smart Basics: What to Know to Keep Your Heart Healthy. It provides definitions for common heart disease-related terms and numbers you should know, such as your ideal blood pressure and cholesterol, and questions to ask your healthcare providers to keep your heart healthy. Another document is another fact sheet is Stress Less for a Healthier Heart, which provides information on how to manage stress for your heart health. Stress is now being also increasingly recognized, just like sleep, as a major risk factor for cardiovascular disease. So managing stress can be very helpful. Finally, there's a self-care tips for heart health fact sheet that offers ideas on how to make your heart health part of your self-care routine. There's also a lot of cookbooks and recipes, both from the NHLBI and the American Heart Association website that provide some guidance in terms of creating heart healthy meals. And we encourage you to take a look at our family members and these can help improve your overall cardiovascular health and lower your risk for heart disease.
Great tips and lots of resources to check out on the websites. Thank you. Yeah, I'm going to turn to some of our audience questions. We've got some great ones here. I'm going to combine a few, but Dr. Sperling, would you help us address for folks in the audience who have a family history, someone in their close family, their parents or siblings perhaps who've had heart disease, how should they be thinking about their risk? When should they get screened? What should they talk with their healthcare provider about?
We think all Americans should be aware of their heart risk even at a young age. For instance, we recommend a cholesterol profile at least after the age of 20 for all Americans every 5 years. But coming back to family history, it's important to talk to our family, to ask these questions. We often don't ask about health issues. So be aware of your individual risks, your individual risk factors, but ask your family members, is there a history of heart disease, heart attack, heart surgery, stroke in the family? And family history can be very important, especially if that family history occurs at a younger age. So being aware of family history is important. The CDC has a My Family health tool that can be used to work on these types of conversations. And they often bring these forward around the Thanksgiving time because we often sit around the Thanksgiving table with our family members. But I do want to add that our genes are not always played out, meaning we get a deck of cards the day we're born. So even if you do have a family history of heart disease, of course, be aware of this, discuss this with your doctor, discuss it with your clinical teams. But your genes can be favorably impacted by so many of the things we've talked about today, by focusing on a heart healthy life, by taking appropriate medications if needed. And amazingly, today, we can prevent most cardiovascular events.
That's great to hear. I think we might have time to get to one more question. I'm going to send this one to you, Dr. Flegg, because you mentioned earlier the role that heart valves play in our heart health. And I'm curious if you have any research you could tell us about or best practices related to keeping our heart valves healthy or the use of surgery in heart valve conditions.
Yes. You want me to tackle that one?
Yes, please.
Okay. Yes. I am a heart valve recipient, so I can speak from personal experience. But I would say that it's clear that the heart with increasing. Hold on just a second. Let me mute it. Sorry. Anyway, with regard to the heart valves and aging, it's true that with increasing age, the wear and tear that the heart valves undergo will increase the risk that they will undergo some structural change, usually not major and usually not enough to cause a need for medications or surgery. But in some cases, particularly if you have some congenital abnormality of the valve, I had a bicuspid aortic valve, which means instead of having 3 cusps, I only had 2. So I needed surgery to actually replace that because with increasing age, that valve that only had two cuffs was undergoing more narrowing than would normally be expected if I had a normal three cuff valve. So there is an interplay there between actually genetics and wear and tear just with increasing age. But in a lot of older adults who have structurally normal valves when they're born, there can still be significant calcification of the valve with increasing age, usually not until the ages of 70 and beyond is it becoming clinically important. But fortunately, we have a couple of very helpful treatments that really are game changers. One that's been around for several decades now is a valve replacement by surgery, which means, of course, that you're going to have to undergo heart surgery, which is a pretty big hurdle, but doable. And at pretty low risk these days because of our improvements in anesthesia care, post-op care, et cetera. But an even greater benefit has been the development of valve techniques that actually can be done by means of a catheter without even having to do surgery, but threading a new valve into your heart to basically take the place of one that's been damaged by wear and tear. And the most common is what's called a transcatheter aortic valve replacement, or TAVR, which has now been done in several 100,000 patients throughout the world. And it actually compares favorably. It's as good and maybe even better than a surgical valve replacement. So this has been a game changer, so that now we really have treatments that are minimally invasive for what used to be considered, requiring open heart surgery.
Well, thank you. It's great to be able to share some of those advances with our audience today. It does look like we are at time for all we can cover during today's session. I just want to thank all of you who joined in, listened, asked questions. I apologize if we weren't able to get to your question today. It was a packed list, but I would direct you for more information on everything we've talked about related to heart health and aging to visit any of our websites. So the National Institute on Aging, Million Hearts through the CDC, and the National Heart, Lung, and Blood Institute. Again, thank you to everyone who joined us, and a special thank you to my colleagues, Dr. Flagg and Dr. Sperling. It's been a lot of fun having this Q&A with you today.
Thank you. Our pleasure to participate.
Yeah, thank you. Enjoyed our discussion, and I hope our listeners will take our discussion to heart.